Maybe let me call totally.
My sweet sister is calling me. Hello, sweetie pie. Poa sasa.
Poor. I have a question for you. I'm studying for my proctor now. Kuna dots connect hapa.
Okay.
So I'm gonna read for you a question and you help me connect these dots, okay?
Why don't we make this the learning medicine on Monday videos? Are you okay with that?
Okay, sounds good.
Okay.
Sounds good, baby girl. Sounds good.
Okay, sounds good.
Hi guys, it's your girl Lydian PC here, back again with another educational, motivational, and inspiring video. Today is Monday, meaning we are going to learn about medicine because on Mondays we connect medical dots. So today's session is a little bit different. My sister has a medicine related question that she'd like us to discuss and figure out what the answer is. All right, so sit back, relax, enjoy, learn, and become smarter. All right.
All right, here goes my question.
Okay.
So a nurse is caring for a client who has a chronic glomerulonephritis.
Okay, glomerulonephritis.
Yes, with oliguria. For which of the following electrolyte imbalances should the nurse monitor? A. Hypercalcemia. B. Hyperkalemia. C. Hypomagnesemia. And D. Hypophosphatemia.
So many big medical terms. Naomi, you're throwing jargons at me. Okay. Can we start step by step? Because for me, I have to process slowly by slowly. So what's the first sentence?
So a nurse is caring for a client who has chronic glomerulonephritis.
Okay, let's pause there.
All right.
Glomerulonephritis. So I know itis means inflammation, kind of. So glomerular, yeah. So I guess this patient has inflammation of his glomerulus, yeah?
It's chronic.
And it's chronic. Okay. For those who are not familiar with medical terms, glomerulus is a tissue in the kidney, correct? That helps to filter your blood and then it produces urine. Chronic meaning it has been ongoing for a long time. So a patient with chronic glomerulonephritis has inflammation of his glomerulus that has been ongoing for a long time. Okay, now we are on the same page.
Yes, we are.
Okay.
So this patient has that condition and oliguria.
Oliguria.
Yes.
So urea, I know, has something to do with urine. So oliguria, maybe he's producing very little urine,
Yes.
which makes sense. So if his nephrons and glomerulus are inflamed, so meaning they're not able to produce enough urine, okay?
Yes.
So which of the following electrolyte imbalances should the nurse monitor?
A.
Wait.
Hypercalcemia.
Okay, before we go to the answers, so which of the following electrolytes, yeah, should the nurse monitor? So in other words, we're being told, like, what should the nurse pay attention to, given that this patient has a long-standing issue with his kidney and has issues filtering and producing urine, correct? So what electrolyte? So with my little knowledge of nephrology or biochemistry, before I even go to the answers, I have to start reasoning and predict my answer before I even look at the answer choices, right? So I do know with a normal functioning kidney, yeah, it usually filters out like the waste from our bodies, and then it also helps with reabsorbing the useful elements that we need, right? Electrolytes are like salts that can dissolve in water. So I do know usually with a normal functioning kidney, we reabsorb sodium back to the body so that we can reabsorb water back. And then usually we excrete or we get rid of excess potassium, urea, and just other waste products, yeah? And even if we have an excess of sodium, we can excrete some, but usually we reabsorb sodium and we excrete potassium.
Okay.
So I'm going to break predict my answer
I'm
here.
already seeing that just by you explaining that has made sense to me.
Really?
Yes.
Okay. I'm
Yes.
glad the dots are connected.
Yes.
Okay. So then I guess in this case, so what should the nurse monitor?
So with a normal functioning kidney, the patient should have normal sodium and potassium level. But if the kidneys are messed up, it means they are not able to excrete potassium like they normally are. So I'm gonna guess this patient, the nurse should pay attention to hyperkalemia, high levels of potassium.
Oh my goodness, it makes sense. It makes sense. I think that's the answer, and I'm gonna check it out. Let me see.
Okay.
Yes, that's the answer. Thank you.
Connecting medical dots.
Thank you. Thank you so much, Totally. Thank you.
Yeah, see, I don't have to memorize. We don't have to memorize the entire textbook. We can just understand the basics and then we reason out from there.
Yes, thank you. I appreciate your time. Thank you so much.
Okay, so I'm curious to know, what does the explanation say on your textbook?
Okay, so let me read it here quick, okay?
Mm-hmm.
So it says oliguria resulting from chronic glomerulonephritis causes potassium retention, leading to levels above the expected range, which is 3.5 to 5.
Mm-hmm.
So that's it. That's what all it's saying right now. And then there are other electrolyte imbalances too, like that affect the sodium and phosphorus level as well, which eventually leads to end-stage kidney disease, which is very interesting.
Yeah, so yeah, this is a very interesting case. So of course, some of the diseases that affect your kidney and how it works are diabetes, which I think is a topic that maybe, Naomi, we should talk about in the future because it affects so many people.
Yeah.
But when your kidneys are affected, you're not producing urine properly, meaning you're not getting rid of the waste in your body properly, and so you can really get intoxicated with your own waste if you have a kidney issue. So, but anyway, today this is a different way of presenting the Learning Medicine on Monday. So sometimes we present general topics, and today we just wanted to tackle like an academic topic, right, Naomi?
Yes, I really needed your help because I couldn't figure that out. There were big terms there. So, but yeah, thank you. The dots have connected. Thank you.
The dots have connected. There you go. Because the thing is, like I always say, I am not your doctor. I am not a doctor yet. I'm just a medical student learning medicine, and I am taking you with me. And my sister helps me with running this session. So Naomi, thank you so much.
You are welcome, and thank you so much. I appreciate it. Thank you.
Okay, bye-bye.
Bye. Thank you.
Mhm.